Hi everyone, I'd like to welcome you to today's webinar. My name is Alex Jameson. I'm part of the team here at PolicyMedical. I'll be your moderator for today's webinar, which is entitled Policy Manager versus SharePoint. It's structured to give you the information you need to decide the right policy management platform for your healthcare organisation. This session is being recorded and everyone will be sent an email within 24 hours of this webinar session with a link to the recording. If you have any questions throughout the webinar session, please type your questions into the chat box on the window on the right-hand side of your screen. Now I'd like to introduce our speaker and storyteller for today's webinar, Saad Juman, President and CEO of PolicyMedical. Saad started his policy management software adventure 15 years ago in his mum's basement, but now heads up the more comfortable team office here in Toronto. So at this point, I'd like to hand over to Saad.
Hi there, thank you, Alex, and welcome everybody to today's webinar. I appreciate you taking the time. As promised, we're going to wrap this webinar up within the 30-minute time frame that we promised you. So it'll be hopefully a quick and impactful webinar. I wanted to do a very quick audio and visual check for you right now. So if in the chat box on the right-hand side of your screen, if you can just type in, I can hear you just fine, loud and clear, or if you want me to speak up, just let me know, speak up, and we'll just gather a few responses here. And also visually, you should be seeing a slide on the screen with my picture on there.
Okay.
Yep. Okay. Okay. So I see some comments coming in, Alex.
Yeah, everyone's saying they can hear you loud and clear.
Okay, perfect. Perfect. Thank you for that feedback. Now, thank you and welcome everyone, and thanks again for joining us. So right off the bat, I want to bring the attention back to you, our attendees. What you're interested in is the value we can help provide to you in selecting the right system. So I'm going to jump right away into the takeaways of this webinar session, because when I usually devote a lunch hour or a late morning or early afternoon session to a webinar with my schedule, I want some tangible takeaways as well. So what's in it for you? After the webinar, we'll be sending you these tools which will further aid you in finding the healthcare policy management software that's right for your organization. So we're going to have 3 tools today. The first one is a time tracking sheet that's going to help you make sense of what's going on with your current policy and procedure process right now. The second tool is our 8 steps to selecting the right policy management platform. And the third tool is our comparison matrix or comparison sheet comparing policy management software and SharePoint. So before we get into the actual content of the webinar, I'd like to get a bit of information or a little bit of a pulse about all of the attendees on the webinar today. And again, as I see attendees streaming in here by the tens logging on here, so thank you all for that. You'll see a poll question appearing on your screen right now that says, how are you currently managing your policies and procedures? This will help me get a reference point for the rest of the webinar. So go ahead and answer that particular poll right now. We'll give you about 20 to 30 seconds to do so. Okay, I see the results are coming in here. Okay, great. I think we've got the results. So the results currently say that 63% of you are currently using Microsoft SharePoint, 25% are using some type of policy management software, and 13% are using a combination. That's actually quite insightful, because you're really not alone. Currently, about 60% of healthcare facilities in the United States are using either a paper-based solution, intranet-based system, or a homegrown system. So before we get into this, I just want to sort of anchor us and you in some of the pains, the risks, and the financial impacts that you might be dealing with. Now, some of these might be an eye-opener to you. Others you might be able to relate to directly. So common pains of incorrectly managing policies and procedures would include things such as finding the right policy, keeping your drafts and different versions organized, getting the policy approved in a timely manner. Risks might be a lack of comprehension or the content of the actual policy, outdated policies, insufficient audit trails of policies when dealing with claims and lawsuits, and some of the common financial impacts on your hospital's operational efficiencies would include basic paper costs, ink from printers, actual payroll going out to the amount of hours that your staff is actually taking to manage policies, the cost of lawsuits and claims, and the list goes on and on and on. And again, I just wanted to reiterate to you, there's no need to make any notes of anything you're seeing on the screen right now. We're going to email you the entire presentation along with the tools within a week of this particular webinar. So now we're going to switch gears as I jump into how to undergo a process for evaluating the right platform for you to manage your policies and procedures. Personally, I like stories, and stories are more engaging for all of us. Just ask my two boys, who not only like to hear and listen to superhero stories, but now take it upon themselves to dress and act and live it out each morning. So I'm going to tell you a story. This story is the aggregation of hundreds of hospitals that I've personally worked with over a decade to solve their policy challenges. The names and places in the following story may be fictional, but the information and circumstances are certainly real. I'm still here, just had to get a sip of my green tea. So let's meet the first of our main characters. Meet Judy. She's the head of quality and patient safety at Mountain Springs Health System. Judy is driven by a passion to make patients' lives that much safer when visiting Mountain Springs Health System. One of her main accreditation and regulatory compliance agencies just left after showing up for their unannounced survey 1 week ago at 6 a.m. in the morning. Some of you on the webinar today might relate to those 6 a.m. Surveyor visits early morning at times. During several tracers and other general interviewing of staff, the preliminary results of the survey on her desk says that it's taking staff anywhere between 5 to 30 minutes to find policies and procedures. That's if they can find it, and over 30% of the time, they pulled up obsolete policies. Now, the surveyor also asked several nursing staff on the floor to show the hand washing policy that is in use at the hospital. 11 different staff members pulled up 8 different hand hygiene policies from 8 different policy manuals. None were actually from infection control where it was supposed to be. This wasn't good, especially since Mountain Springs Health System has had an ongoing campaign for all patients and staff to hit home the message that hand washing prevents infections. One of the last points that catches Judy's attention is the fact that the surveyor's notes also indicate that staff routinely access policies and procedures from many different sources. These sources being their personal computers, binders, bulletin boards, shared drives, and the hospital intranet. This surprises Judy as being the chair of the Policy and Procedure Committee, in which they collectively decided and published all policies on their intranet for all staff to browse and access. So why were they going back to their old habits and sources of finding policies? Speaking of a policy committee, a calendar alert goes off in Judy's BlackBerry, reminding her that she has a monthly policy committee meeting soon. She's come to dread these meetings since the department heads just do not seem to be getting their policies updated on time. In fact, her assistant is constantly reminding them of when their policy updates are due, and it seems that the only progress is made when they physically get together to collaborate on policy updates. Too bad they only meet once a month. Judy needs a coffee, so off to Starbucks she goes in the lobby. As she gets up to leave, her phone rings. It's Tate Johnson, legal counsel for the hospital. He's working on a court case where a patient slipped and fell 3 years ago in the lobby. Tate needs the fall prevention policy that was in place at that time, and he suspects that version may have been updated incorrectly by a staff member that is no longer at the hospital. Therefore, he needs the notes and changes leading up to that particular version of that policy. Judy calls in her assistant and asks her to go down to the basement of the hospital to look through an old filing cabinet. Now, I know some of you at the that are dialing in from various hospitals across the continent actually can relate to archives being housed in an old filing cabinet in your basement. It happens to be in the Human Resources Department that houses a lot, but not all of the hospital's archived policies. She also directs her assistant to double-check an older shared drive that may house archives for the version of the fall prevention policy being requested by legal. Judy grabs her BlackBerry, notebook, a copy of the survey results, and most importantly, a report her assistant just gave her of the available healthcare policy management solutions. The policy management solutions were yielded from a few hours of simple Googling, along with several calls to Judy's quality, compliance, and risk management colleagues across the state to see which and what they were using. Judy runs off to the policy committee meeting that is about to start in about 5 minutes. Guess you can say Judy's having a pretty hectic day. Unfortunately, these days are becoming more and more common as the months go by. Let's meet our second character, Scott, who's head of information technology. Let's check in to see how Scott's day is going. Scott's focused on what is consuming his time, his team, and overall resources. He's feeling pretty good about his server virtualization project. That took 6 months, 2 months less than projected, but was a great success. Right now, he's 11 months into his epic deployment. There are 13 months left, and his IT staff is being used at close to 95% for this particular project. It's hectic but under control. As long as no other small to mid-sized requests come in, he will be on time with this deployment. He does have one other housekeeping item his chief operating officer has put on his plate this year, which is to figure out how to amalgamate all of the various web-based solutions and applications into one platform or framework. Right now, Scott's inventory of systems shows just under 50 different applications being used in both the clinical and non-clinical setting. Mountain Springs Health System is already using Microsoft SharePoint, so this one was easy. Just leverage SharePoint as a portal for all of these applications. Just then, one of Scott's help desk staff, Carlos, pops his head into Scott's office to remind him of a policy and procedure committee meeting he was invited to out of the blue last week. They wanted to pick his brain on which policy management system he felt was best for Mountain Springs to use. This should only take a few minutes, as Scott was just going to let them know that they already have Microsoft SharePoint in-house for free, and his staff could whip up a policy portal for them based on their requirements. He could probably get this done with the 5% resource capacity he had left, even during the EMR deployment. Additional systems they might want were not necessary, as Scott's team could get the policies posted, control access, and make them a bit searchable. What else would they need? Plus, the last thing Scott wanted was to add another system to the mix. His plan was to drop into the meeting, give his feedback, and be out in 10 minutes, giving him enough time to drop into that new Starbucks in the lobby to get his favorite coffee. The agenda item of a policy management system came up finally in the Policy and Procedure Committee meeting. It did not go the way that either Judy or Scott thought. Prior to this, neither had the opportunity to work closely at all, which conceptually was strange, as Judy was in charge of making sure the standard of patient safety was as high as possible. Scott, on the other hand, was in charge of ensuring that the hospital leveraged technology to drive patient safety. This might be a common sort of tug and war that you may see at your particular hospitals for all of those listening into the webinar today. Judy presented her requirements for a policy management system to the committee. She listed many features and benefits needed. Her main drivers are pressure from regulatory and accreditation agencies to better manage and access policies, a lack of employee compliance to policies which negatively impacts patient safety, saving money overall by reducing the time it takes for employees to get to policies, less paper and ink costs, less money paid out in claims and legal fees. Her goal was to present the various systems her assistant researched and get Scott's blessing on which system to move ahead with. Based on the pricing her assistant received, Judy had enough left in her budget to invest in a policy management system. It was Scott's turn to give his advice. Scott told the committee about the EMR deployment and other major IT projects that were consuming resources. It would be difficult to support a deployment of another system in the hospital. He touched on his own pain of trying to consolidate the access of all the systems and applications the hospital had acquired over the past 10 years into one centralized portal. His recommendation? Why not use Microsoft SharePoint? Almost all the hospitals, including Mountain Springs, had the free Microsoft SharePoint Foundations version. They could build on it to meet Judy's needs. This would open up Judy's budget for other purchases, leverage an existing product the hospital already had in-house, and zeroing in on Scott's need to centralize applications. Scott's and Judy's perspective landed them in a virtual stalemate. Judy's familiar with Microsoft SharePoint. She knows that the former CIO, whom Scott has now replaced, had set up the system for nursing policies based on a request made by the CNO last year. Judy and the CNO are part of the policy committee and decided to do an assessment with frontline nursing staff for how the Microsoft SharePoint portal was working. The feedback was not encouraging. They found it complicated to search for and access policies. Staff are simply not using it, which led to all sorts of safety issues. Judy said to the policy committee, quote, "Having a system that staff didn't use is just as bad as not having a system at all," end quote. Scott actually spoke to a few of the nursing directors, and several of them told him over a lunch in the cafeteria recently that Microsoft SharePoint was an overall improvement from binders and the intranet. If they could change one thing, it would be to have training on it for all staff. There wasn't any training when it was instituted, and they had to learn it all on their own. Scott said the following to the policy committee in an attempt to wrap up the policy committee meeting. If we tweak Microsoft SharePoint further and roll out training for all the frontline staff, IT will be able to get Judy what she needs for the hospital's policy management needs. To break the stalemate, Karen, the CEO, who was sitting in on this month's policy committee meeting, offered to line up a lunch with Joe, who was the former CEO of Mountain Springs Health System and the current chairman of the State Hospital Association. He apparently has a passion for policy management and has helped many hospitals conquer what he called policy chaos. Now, a quick question for you, just pausing from the story for a second, and you can type this into the chat box on the right-hand side. I'm just curious to kind of take just a quick impromptu pulse. How many of you have experienced this divide between your own departments? Just type in just to let me know. So how many of you have experienced the divide really between IT and maybe end users, or maybe your department and others? Okay, interesting. Quite a few of you have been experiencing this, and maybe about 7 or so of you have said that you haven't experienced this at all. So quite a varied response in that one. Now, continuing on with the story, let's get back to our two characters. Judy and Scott settled into a small boardroom overlooking the sprawling campus of Sprott University. Now, at Sprott University, Joe also taught a course on the intersection of patient safety and technology for one of the leading Masters of Health Administration programs in the country. In walks Joe, their soon-to-be mentor in overcoming policy chaos. Joe went on to say the following: "Many people think that SharePoint's integration with other Microsoft products is an easy way to create a document management system. The reality is that for many companies, this solution just won't work. SharePoint is a powerful application architecture that can do many things, including document management. However, it requires a significant amount of investment and coordination with your information technology staff to implement." Now, here's the typical way that we can sort of guide you within this webinar of how to get a handle in assessing which mode of managing policies might work better for you. So the first thing to look at when looking at your current policy and procedure management process is to identify the different types of roles you have or may need in your policy management process. The second thing to take a look at is to analyze the document or policy usage. How are people accessing and utilizing policies and procedures? Then you need to kind of think through how you want to organize your documents and policies. So thinking through the taxonomy and table of contents of your policies. Then you may want to think about the various content types. So are you going to have policies with forms, policies and procedures? Are you going to integrate contracts side by side with policies? Then you want to take a look at your workflow and approval process to see the path of approval for actually approving your policies and procedures. Typically based on my personal experience, I haven't seen sort of advanced features. Advanced features would be features along the lines of workflow approval and collaboration in a Microsoft SharePoint type product, but I have seen it in numerous sort of off-the-shelf policy management applications out there. Now let's go on to Joe's recommendation to Judy and Scott. Joe's recommendation for Mountain Springs Health System, considering they're using Microsoft SharePoint Foundations, is an integrated approach, which is use SharePoint to improve their intranet and integrate a policy management solution on top. Now, in my comments, and this is Saad speaking, not Joe, SharePoint is unlikely to provide you a return on your investment on its own. Now, we're not saying that it's bad, but we're saying on its own, you may not get the ROI that you think you may get. The necessary customization required and the personnel required maintaining the system is really significant. But when SharePoint is combined with a robust document management system that's focused on your needs, the end result is a quick ROI and a wonderful end user experience for everyone at the hospital. This would be the overall recommendation for a hospital that is already actively using SharePoint. For a hospital that does not use SharePoint or has SharePoint in what I'd call a dormant mode, a standalone policy management system will yield results quicker, generate better user acceptance, and create an ROI faster. Now to recap and in summary, you've heard a story about the entire process for selecting a policy management solution from the perspective of quality and the perspective of IT. Now what? Well, as I mentioned at the beginning of the webinar, we're going to be sending you 3 pretty valuable tools, and these will actually help you discover and uncover those answers that are right for your particular healthcare organization. Those tools, once again, would be our time tracking sheet, our 8 steps to selecting the right policy management platform, and our policy management software versus SharePoint comparison sheet. And again, the collaboration between the 2 platforms, I would personally recommend would be the best if you're actively using SharePoint. If you're not actively using SharePoint, then it might be worthwhile for you to take a look at some of the top vendors out there. And we have we have an article on that topic in our Knowledge Center where we in-depth analyze the top 4 or 5 software applications and vendors out there. Now a final poll. You'll see that coming up in your screen. This particular poll is asking you, which platform do you think is the best fit for your healthcare organization? Again, there may be some perceived bias with a webinar like this because we are PolicyMedical. I am the CEO of PolicyMedical, but I'd be the first to admit, by no means is our particular application the best fit for all hospitals and all healthcare organizations out there. I'd say it's a fit only for some. So really, by going through the tools and by doing your own analysis, you're going to find the one that best works for you and really for your organization's culture. Not every vendor, not every application and approach is ideal for every organization. Okay, so we see that 80% of you feel that a policy management software application would be ideal for you, and 20% believe that a Microsoft SharePoint approach would be ideal. Okay, that's great. I'm going to hand it over to Alex right now.
Thank you, Saad. If anyone has any further questions related to the topic of our webinar, feel free to contact us. And if or contact Saad directly, you can email, his email address is up on the screen there just now, or you can just get general information at info@policymedical.com, or you can visit our website. We've got further resources as well, which you can, if you visit our website, there's a knowledge center that has various articles. You will also be able to access this webinar there, and there's various other publications like white papers and things like that that are available for you to download. I just want to thank everyone for coming today. This webinar will be sent out to you within 24 hours along with the tools mentioned. And just to see if you guys have any further questions based on today's webinar, just type them into the questions box or the chat box on the right hand of your screen.
Now we've got about 5 minutes left, or 4 minutes left. And again, we like to maintain our promise of keeping this webinar within 30 minutes and not sort of dragging on longer. So we're just aggregating a few questions. We see a few coming in, and we're just, okay, so I'm gonna start answering a few questions. Any questions that we don't get a chance to answer within the 30 minutes, we'll be sure to type those out and email the answers along with the questions to everybody in our follow-up email within a week. So a question that came in here is, what's the best policy management software out there? So I see that Pam is asking that, what's the best policy management software out there? I would say, Pam, again, it'd be great for me to say our policy management system is the best out there, but I don't think that would be the truth. I think you need to kind of take a look at would SharePoint work for you, and if it doesn't work for you, taking a look at sort of the leading policy management vendors out there, and before even that, meeting with your policy and procedure committee to find out what it is that you actually need from a solution, and then trying to find a particular solution. Another question that's coming in this is from Peter. Peter is asking, how long would it take to build a policy management system with SharePoint? Again, I'm not an expert in how long it would take to build it. I can simply speak from my last 15 years or so of experience. So we haven't actually seen a full-fledged policy management system built in Microsoft SharePoint before. We've seen it, well, that's not true. We've seen it once before with a great hospital out in the state of Tennessee, and they actually built pretty close to what we have for our company. But it took them about 3 years to actually build that, and a team of approximately 5 engineers to build it. And then what was the difficult part for them afterwards was maintaining the system and having an engineer or two full-time to maintain the system. So with that, I'd like to wrap it up. I know there are a few other questions I was not able to get to within the time, but again, we'll type out the answers in the question, send those along with the tools, along with the presentation slide deck, so you all have all information. And again, if I can be of service to you in any other way, please do not hesitate to email me directly or anyone here at PolicyMedical. Thank you again for your time.